1. Republicans are cutting Medicare, not just Medicaid. 2. Impact of Trump's Megabill on Oregon's Medicaid coverage. 1. Republicans are cutting Medicare, not just Medicaid. The Medicare crisis no one's talking about. Republicans' hidden $490 billion cut. In a shocking development that's flying under the radar, Republicans aren't just targeting Medicaid, they are orchestrating one of the largest Medicare cuts in history. Here's why every American should be concerned. In the early hours of this morning, the House Freedom Caucus, predictably falling in line behind Donald Trump, gave their support to a controversial megabill that fundamentally reshapes American healthcare. But here's the bombshell that's been largely overlooked. Hidden within this legislation is a mechanism that would force nearly $500 billion in Medicare cuts over the next decade. The story begins with what's being called the Big Beautiful Bill, which adds approximately $3.3 trillion to the national debt over 10 years. But here's where it gets complicated and concerning. Due to the statutory Pay-As-You-Go, PAYGO, Act of 2010, this deficit increase triggers automatic spending cuts across government programs. Medicare, unlike some other programs, isn't protected from these cuts. The numbers are staggering. Starting October 2025, Medicare faces $45 billion in cuts for the first year alone, escalating to $75 billion by 2034. The total damage? A whopping $490 billion over 10 years. The Congressional Budget Office has confirmed these figures, yet they've barely entered the public discourse. But it gets worse. Beyond these automatic cuts, the bill also threatens the Medicare Savings Program, which helps low-income seniors afford their prescriptions. Over 1.3 million vulnerable seniors could lose access to affordable medications, potentially leading to increased mortality rates. The implications are severe: reduced access to doctors and hospitals, higher premiums for seniors, and possible closure of healthcare facilities. Combined with existing Medicaid cuts and other healthcare changes, this could push America's healthcare system toward what experts are calling a point of no return. Particularly controversial is the timing. While many safety net cuts are conveniently delayed until after upcoming elections, these Medicare cuts must begin next year. This raises an important question. Are lawmakers hoping voters won't notice until it's too late? Even more puzzling is President Trump's stance. Despite promising not to touch Medicare during his presidency, these cuts would happen under his watch, similar to his unfulfilled promise about protecting Medicaid. What's your take on this situation? Are these Medicare cuts a necessary evil for deficit reduction, or is this an attack on America's seniors? Should healthcare funding be sacrificed for tax cuts that primarily benefit the wealthy? Share your thoughts in the comments below. For those wanting to learn more or share insights about the Big Beautiful Bill, especially Hill staffers, policymakers, or healthcare experts, reach out to info@prospect.org. 2. Impact of Trump's Megabill on Oregon's Medicaid coverage. Massive changes are looming for health coverage in Oregon, and the stakes couldn't be higher. Last week, President Trump enacted a sweeping domestic policy bill that's about to shake up Medicaid, taxes, immigration, and environmental programs across America. For Oregonians, the question on everyone's mind is, what does this bill really mean for our health care, and could it leave thousands without coverage? But here's where the controversy really starts to heat up. Independent analyses suggest that Oregon could be hit harder than most states by Medicaid cuts, with large numbers of residents potentially losing their insurance and facing uncertainty about their future care. Eric Hunter, President and CEO of CareOregon, the state's largest Medicaid provider, recently broke down these changes in a conversation with OPB's Jeff Norcross. Their discussion offered frank insights into the bill's impact and raised some tough questions that every Oregonian should consider. The week that changed everything. Jeff Norcross kicked off by asking Hunter what it was like to watch the constantly evolving bills in Congress last week. Hunter described the experience as a whirlwind, a week full of anticipation and anxiety. For CareOregon, months of concern about deep health care rollbacks came to a head. We were hoping for compromise, Hunter explained. But in the end, we saw some of the harshest changes to health care policy we've ever faced. A key message Hunter wants to stress is that, for now, nothing is changing overnight for Oregon Health Plan members. We've gotten a flood of worried calls, from both members and providers, asking if their coverage is disappearing right away, he shared. The answer is no. Benefits remain the same for now, and we are committed to serving our community. But, he cautions, we need to start preparing for difficult changes ahead. Work requirements, unintended consequences. One of the bill's most contentious features is the new requirement for adults aged 19 to 64. To keep Medicaid coverage, they'll need to prove they are working or volunteering at least 80 hours a month. Plus, nearly 40% of Oregon Health Plan members will face more frequent eligibility reviews. Here's the catch: it's not just about whether people meet the criteria, but whether they can navigate a maze of paperwork and bureaucracy. Hunter points to Arkansas and Georgia, where similar policies led to many losing coverage, not because they didn't qualify, but because the process was too complex to manage. Imagine if you suddenly had to file your taxes twice a year instead of once, Hunter said. Even people who should remain eligible could lose their coverage simply because the process is so burdensome. That's not just unfair, it can harm people's health and end up costing the system even more when they return sicker and in need of urgent care. Is this requirement a reasonable way to ensure accountability, or is it an unnecessary barrier that punishes the most vulnerable? That's a debate begging for a lively comment thread. Provider tax cuts and tough choices ahead. Another complex, and hotly debated, change involves a reduction in the state's provider tax rate, a key funding mechanism for Medicaid in Oregon. Previously set at 6%, the new law slashes it to 3.5%. At first glance, this might seem like an inside baseball detail, but it's actually a critical pillar of the Oregon Health Plan's funding. Hunter explained, this tax and the federal match together make up about a quarter of the Oregon Health Plan's total budget. If those dollars drop, Oregon faces some painful choices: raise revenue elsewhere, cut benefits, or remove people from Medicaid. And here's the part most people overlook: every dollar lost puts more pressure on an already stretched system, which could mean fewer services, less coverage, or both. Are there any silver linings? Norcross then asked if there's anything in the bill that could benefit CareOregon or its members. Hunter said they are always committed to using public funds responsibly. The bill does include some provisions to help crack down on genuine fraud, waste, and abuse, something everyone can get behind if it means making the system work better for those who rely on it. However, Hunter pointed out that the bill's attempt to help struggling rural hospitals is likely too little, too late. Will it fix the enormous gaps and financial pain that rural hospitals, especially in blue states like Oregon, are facing? No. But it's a small step to minimize some of the damage. He gave a blunt assessment: honestly, there's not much that's positive in this bill. Budgets reflect values, and too often, the real priority isn't public health, it's cutting taxes, or redirecting money elsewhere. A future full of difficult choices. Norcross closed by asking how CareOregon is preparing for the changes to come. Hunter acknowledged that health care in Oregon is already on the edge. While the state has secured rates that should help keep basic benefits in place by 2026, many vital community projects that address root causes of poor health, like supportive housing for vulnerable populations in places like Seaside, are now in jeopardy. Those are the kinds of projects that really strengthen communities, Hunter said, but with these funding cuts, we simply won't be able to do them anymore. And that's going to hurt. So, is this bill a necessary step to rein in costs and ensure accountability? Or does it risk undermining the health care safety net for thousands of Oregonians? And now, the big question, do you think these changes will improve our system, or make life harder for the people who need care the most? Jump into the comments and let us know where you stand. Should these reforms be applauded, or are they a step too far?